A new study finds young children who are hospitalized with COVID-19 and then test positive for a second virus are twice as likely to develop more serious symptoms. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you, doctor.
Hey, Dr. Moffitt. Great to see you.
Hi.
So,
good to see you too.
Obviously, you've treated a number of kids this winter. You've treated with COVID, with the flu, RSV, but two viruses at the same time. How common is that?
It's not actually all that uncommon if there is a time when we have very high levels of multiple respiratory viruses circulating in the community at the same time. In this study, for example, they found that about 1/5 of children under the age of 5 who were admitted with COVID-19 had detection of a second respiratory virus at the same time. And this study only covered through February of 2022, but in my experience as well, more recently, in these last several months, when we had overlapping surges of RSV and influenza and COVID-19 and a number of other respiratory viruses, it was not that uncommon for a child with symptoms of a respiratory viral infection to test positive for more than one virus at the same time.
And speaking of overlapping, all three viruses have some symptoms that overlap as well. Is that why researchers think that maybe they become more severe?
Yeah, I think part of what we think of in terms of the severity of these symptoms is that a lot of these symptoms are actually driven by our own immune response to the virus. So you could imagine that if someone is infected with multiple viruses at the same time, they may be generating even more of an immune response to those viruses. And the immune response can contribute to things like fever and even respiratory distress and some more severe disease in the lower airways. So that probably is what is contributing to more severe symptoms in these patients who are infected with multiple things at the same time.
And Dr. Moffitt, most families have at-home tests for COVID, but not for flu or for RSV. So in your opinion, is it necessary, for example, to ask a pediatrician, hey, would you test my kid for all three?
I really think it depends on the severity of the symptoms. If your child has symptoms of a respiratory illness at home and they test positive for COVID-19 and you feel comfortable managing their symptoms at home, then you're sort of all set. If they test negative for COVID-19, but you still feel pretty comfortable managing their symptoms at home, you may not need to get a test unless your child might qualify for an anti-flu, antiviral medication or something like that. So in those scenarios, it's probably worth a conversation with your pediatrician who knows your child's medical history, and they could discuss with you what they have for testing available in the office.
Okay, makes sense. Dr. Moffitt, we always appreciate your insight.
Thanks, Dr. Moffitt. Take care.
And to our viewers, by the way, if you have COVID-related questions that you'd like our experts to answer, you can email them to ask@wcvb.com.